whatever we can measure is we can manage. As simple as that. If we don't get the correct information on how many cases of cancer are there in the country, we will not be able to form policies or channelize the resources in the correct direction. The Parliamentary 139th Committee on Health has suggested that cancer should be made notifiable in India. Why have they said it? They have said it because we have cases of cancer coming up, but they're not being recorded fully, and notification is something, so what is notification? As soon as you're a doctor, you see a patient having a particular disease, you have to inform the government authorities that I have this one patient and he has this disease. So they make a record of it at a central database. It can be at the state level or at the central level. So the Parliamentary Committee has recommended that cancer should be made notifiable in India. The government's own body, which runs the cancer registry, their scientists, it's called NCDIR, National Center for Disease Informatics Research under ICMR, which is India Council for Medical Research. They have themselves said that cancer should be made notifiable so that we can get more data. I'll first look at why I started looking at this question. So I was looking at the cases of mesothelioma because mesothelioma is almost always caused by asbestos exposure. So it can be a very good proxy of finding out how much has been the medical effect of asbestos exposure. So when I was looking at it, I realized that I have to look at the registry, and the registry is run by NCDIR, National Center for Disease Informatics Research, Bangalore. So when I looked at their reports, not all the hospitals are in the cancer registry program. So there are a lot of hospitals where they have diagnosed cases which are not reported to the registry program. Because it's not registered in the registry program, everybody is relying on that data. So we don't get the exact numbers. And when we are informing international agencies, they also don't get the exact information on India. So that is something that should be done with high priority.